neurologist, I see a lot of people in clinic who have memory problems. And a lot of people I see are confused as to what dementia is and what Alzheimer's is. Is all Alzheimer's dementia? Is all dementia Alzheimer's? Which one is worse? I think this video will really help clear up some of these questions. So let's dive in. Hey everybody, welcome back to another episode of NeuroWorld-MD. I am Dr. Parker Bohm, and I am on a mission to provide you with high-quality, educational neurology content. I did my residency training at the Mayo Clinic in Florida and my fellowship in neuro-ophthalmology at Washington University in St. Louis. Today we're going to talk about dementia and Alzheimer's, and specifically some of the differences between the two. So I've had a lot of people say things like, oh yeah, my grandma had Alzheimer's later in life, but at least it wasn't dementia. And then I've had some other people say, oh yeah, my grandpa, he couldn't remember anything, but it wasn't Alzheimer's. So there's a lot of confusion about these terms. So let's start with talking about what dementia is first, and then after that we will talk about what Alzheimer's is. So dementia is an umbrella term that basically means any sort of brain issue that is sufficient enough to cause cognitive problems, so think memory or thinking problems, that are bad enough to interfere with one's ability to live their day-to-day life. And most of the time when we're talking about dementia, we're talking about something that's a fixed or a permanent problem, and oftentimes we're talking about one that will progressively get worse over time, although that's not always the case. And dementia is unfortunately very common as we age. So in 2025, researchers estimated that the lifetime risk of developing dementia was about 42%, or about 4 out of every 10 people, in those over the age of 55. And there are actually a lot of different types of dementia. So the most common type of dementia is actually Alzheimer's disease, and we're going to talk about that in a little bit. Another common type of dementia is what we call vascular dementia. So this encompasses people who get dementia after having a stroke. And it doesn't always have to be a huge stroke that affects like most of one side of the brain and causes paralysis on one side and other things like that. Sometimes it can be a stroke that's unfortunately just in the wrong place. There's a very small part of the brain, deep in the brain, called the thalamus. And I've seen some patients who just get a small little stroke there. And if it was in another part of the brain, it probably wouldn't have caused any problems. But in the thalamus, it can sometimes cause some major cognitive problems, memory problems, or speaking problems. And then some people who have vascular dementia, they don't have a specific discrete stroke, but over time, the tiny blood vessels going up to the brain start to become blocked, and you can see this in people who have history of major high blood pressure or high cholesterol or smoking or diabetes or sometimes just genetic predisposition. And in these patients, when these tiny little arteries start to become blocked over time, it can cause what's called cerebral small vessel disease. And that's where we see a lot of white spots on the MRI scan. So that can be a cause of vascular dementia. Another cause of dementia is what we call dementia with Lewy bodies, or Lewy body dementia. This is a type of dementia that is associated with Parkinson's-like symptoms, and people oftentimes also have major hallucinations as part of this. The actor Robin Williams actually had this type of dementia. Parkinson's itself, if somebody has it long enough, can lead to Parkinson's disease dementia. There's another type of dementia called frontotemporal dementia, which can cause a lot of behavioral and personality changes. And honestly, a lot of people have what we call a mixed dementia, meaning they have multiple potential causes for their dementia. And honestly, it's really tough to distinguish when people might have a mixed dementia. And that is typically found out like in autopsy studies where researchers are actually looking at the brain under a microscope and they see, oh, this person had some Alzheimer's disease and some Lewy body dementia as well. So it's oftentimes not as clear cut as we make it out to be when people develop dementia. So again, dementia is just the umbrella term meaning that there's some sort of brain problem that is severe enough to where somebody's memory or thinking problems, their cognitive problems, are getting in the way of their ability to live their day-to-day life. Now, what is Alzheimer's disease? And by the way, if you like this content, it would be wonderful if you could drop a like or subscribe to the channel. It really does make a big difference, so I really appreciate it. Okay, now back to the video. Well, like I mentioned, Alzheimer's disease is the most common type of dementia, but it doesn't necessarily always have to be severe enough to cause dementia. Let me unpack that a little bit. So Alzheimer's disease is where people develop cognitive problems due to the deposition or buildup of certain proteins in the brain, namely ones called beta amyloid and tau proteins. And these typically build up slowly over time and cause a slow and progressive worsening of cognitive problems. And oftentimes, in people who have Alzheimer's disease, not all the time, those cognitive problems are really in the form of major short-term memory issues. But when somebody is first developing symptoms of Alzheimer's disease, they may hardly have any symptoms at all. They might just have some very mild short-term memory problems. And yeah, Alzheimer's can be horrible. It can get to the point where people who have Alzheimer's, as many of you know, they don't even recognize their family members. They don't recognize their best friends. They don't recognize their husband or their wife. So it can be super severe, even to the point where people forget how to swallow. They don't want to eat any food. They're just very apathetic and sit there. Typically, that's somebody who has had Alzheimer's disease for a very long time. But like I was saying, some people, when they're first getting symptoms of Alzheimer's disease, it could just be some mild short-term memory loss. So somebody can have Alzheimer's disease, but they're not to the stage of true dementia yet. And when they're in that stage where they have some symptoms due to Alzheimer's, so let's say short-term memory problems, but they can still do all their day-to-day activities. They can cook, they can clean, they can drive, they can do the finances, they can brush their teeth, they can do all those type of things. That's what we call mild cognitive impairment. So you can actually have mild cognitive impairment due to Alzheimer's disease. That patient may never go on to fully develop dementia. Because what if something else happens? What if they get cancer or they get another problem? So you can actually have Alzheimer's, but not dementia. And then it can be the other way around where you can have dementia, but it's not due to Alzheimer's. So hopefully that makes sense, even though it doesn't sound like it makes any sense. And hopefully you will never get dementia. We know that exercise, healthy diet, good sleep, these are all super important for reducing the risk of dementia. And there's a lot of ongoing research right now to figure out when people have the protein building up in their brain, what can be done to get rid of the possibility of that protein actually leading to the true symptoms of Alzheimer's. So even though there's a lot we still have to learn about the specifics of this, we know that, like I said, healthy diet, regular exercise, really good sleep, other things too, like social engagement, personal relationships, keeping up hobbies, keeping mentally sharp. These are all important things for basically your brain health. So if you feel like your life is lacking today in terms of any of those things I talked about, today could be the day where you start to make an effort to really change some of those risk factors for dementia. If you have issues getting to sleep, check out this video I made. It will be linked at the end of this video. But I really appreciate your watching this video and being a part of this channel. I hope you have an amazing rest of the day. If you enjoy content like this, consider subscribing, consider liking the video, and maybe share this with a friend or a family member. So this video has been short and sweet compared to a lot of my videos, but I don't want to make every video super long, and I can make other videos going into more detail of any of the topics I brought up in this video. So in the comments, just let me know if there's any specific video topic or idea that you want me to cover. But anyways, we'll catch you guys later. Have an amazing rest of your day. Peace.